Hello everyone, my name is Dr Chris Critoph and I'm a consultant cardiologist based in Bournemouth. And this video is all about polygenic risk scores and how to understand inherited heart risk. So over the last few years, heart disease prevention has been moving quietly towards a much more personalised approach. We're very good now at measuring things like cholesterol, blood pressure, blood sugar, smoking, weight, fitness, and those things really do matter. But most of us have been in situations or seen situations where the numbers don't quite tell the whole story. Some people seem to do everything right and still develop heart disease relatively early. Others have several traditional risk factors and yet remain well for decades. And increasingly we understand that one of the reasons for this is the difference in genetics. And that's what I want to talk to you about today. So why do your genes matter? Well, most of the tests we do in cardiology measure what we call modifiable risk, things you can change over time, but a significant proportion of your heart disease risk is inherited. Now, this isn't usually down to a single faulty gene. Instead, it's the combined effect of many small genetic variations, each of which nudges your risk very slightly up or down. And on their own, they don't mean much, but together they can have a meaningful impact over a lifetime. Until fairly recently, we didn't have a practical way of measuring this inherited risk, but now we do, using something called a polygenic risk score, or PRS. So what is a polygenic risk score? Well, a polygenic risk score looks at a large number of genetic markers and asks a very simple question. How similar is your genetic pattern to people who developed coronary heart disease compared with those who didn't? So it's important to realise this does not diagnose heart disease and it doesn't predict that something will definitely happen. What it does is give us a measure of inherited susceptibility, something that blood tests and scans can't capture. For many people, this is the missing piece that helps explain why their risk has never felt quite clear. So what sort of people or who might this be useful for? And so this test isn't for everyone, and it's certainly not a screening test, but it can be useful or helpful in situations where there's some uncertainty. For example, a patient or a person who might have mildly raised cholesterol but otherwise lives very healthily, a person who might have a family history of heart disease that's a bit hard to interpret, someone who has been told their short-term risk is low but still feels uneasy about their risk, or they might be unsure about how proactive they really need to be with prevention. So a polygenic risk score doesn't replace standard risk factors, scans or lifestyle advice. What it does do is add context, so decisions about prevention can be better tailored to that individual person. And I want to add a personal note to this, which can, I think, be useful. Now, at the time I recorded this video, it's January 26, and the topic has become personal for my own family. My wife is in her mid-40s, she's active, she eats well, and has no classic features that we associate with high heart risk. But recently, her cholesterol, she hadn't had a cholesterol checked ever, I don't think, but it was found to be a lot higher than we expected, and something that many people experience when they get their cholesterol checked for the first time in their 40s. But then not long afterwards, her father died suddenly from a heart attack out of the blue. Now, as a cardiologist, I deal with heart disease every day, but when it happens in your own family, it lands very differently. And it's a reminder of how silent coronary disease can be and how genetics can sometimes outweigh the outward appearances. So after some discussion, my wife chose to have a polygenic risk score, not to medicalise herself, but to gain some clarity about how seriously she needs to treat prevention. At the time I'm recording this, our children are teenagers, and genetic risk doesn't change, but how and when it becomes relevant does. And understanding inherited risk can help guide decisions much later in life, long before symptoms ever appear. And so this may also be useful for useful information for our children too. So what does the test involve? So although the science is complex, the process is actually very simple. So after an initial discussion and consent process, a home saliva kit. I send that out to you. You provide a sample in your own time and post it directly to the genetics laboratory, and which is based in London. There's no needles and no clinic visit, at least not at that stage. So the laboratory analyses a number of genetic markers and calculates your polygenic risk score using the validated data. And when the results come back, usually in around 5 weeks, I arrange a dedicated consultation, either virtually or in person, to go through the results carefully and put them into your individual context. So this is a consultant cardiologist-led service, not a consumer genetic test that leaves you with numbers that you don't know how to interpret. So how much does it cost? The total cost of the polygenic risk score at the time of the, recording the video is £950. And this includes the test itself, the laboratory analysis, and a full consultation with me to interpret the results and integrate them into your overall heart health plan. But because this is a genetic test, informed consent is essential. And so before any testing is arranged, I offer a 15-minute virtual consultation, which costs just £50. And this is to explain what the PRS can and can't tell you, explore whether it's likely to be useful for you, and answer any questions. But that consultation doesn't commit you to having to go ahead with the test. If you do go ahead, that £50 is deducted from the cost. And if you decide instead to have a standard cardiology consultation, it's deducted from that fee. I also appreciate that this is an expensive test because it's brand new technology. And unlike cholesterol or scans, it's done once in a lifetime. And so I have a 0% finance option available to spread the cost. So to summarise, polygenic risk scores don't diagnose heart disease, they don't replace lifestyle measures or standard medical care, and they aren't right for everyone. But used thoughtfully and in the right context, they can help reduce uncertainty and support more personalised, proportionate prevention. As always, my aim is not to medicalise the healthy, but to use the best available evidence and techniques to prevent disease before it starts, sensibly and responsibly. If you'd like to find out more, you'll find further information on my website, coastalcardiology.co.uk, and you're very welcome to arrange an initial discussion to see whether this may be appropriate for you.